Got a problem with your teeth or gums? Millions of Americans are aching and could use some help. Just pick up the phone. Dr. Adam Hubert with Hubert Family Dentistry will take your call. 812-433-3456, 1-800-959-1440. Doctor, great to have you. Adam, technology in dentistry, they say it's terrific. Is it keeping pace, do you think? And are patients comfortable with it?
Yeah, I think a lot of the things that are coming on the forefront in dentistry when it comes to technology are to advance the patient's comfort and efficiency. So there are a lot of things in the way of just isolating a tooth so that procedures are more efficient, faster, and a lot of those things that we put in people's mouths, water, just the stuff we're cleaning up.
Taking impressions always was a challenge sometimes, but that's improved.
It totally has. On the forefront here, at least in our office, more and more offices are finding that there's a new technology called digital impressions, where by taking a series of pictures in the mouth, the computer can seam those together and essentially give us almost probably a more accurate impression, and we can email that versus sending a physical impression with all the goop and the gagging and all that. So that's really nice.
And again, for young people, do you start them out earlier with the technology?
Yeah. I mean, when it comes to where we've come with x-rays, a lot of times with kids, we can get x-rays on the outside instead of having to put things in their mouth. That has always been a challenge. Not always the case, but in many cases you can. But we also have just a lot of things that, like I said, improve the efficiency of how easily we can deal with patients.
What's a good tip, before we go to a break, what's a good tip, a couple of tips to just keep our teeth healthy? What are some of the things, especially during the summertime? Are we drinking too much carbonation, sugar, things like that?
Sure. Regular checkups are always the easiest way to keep up on things. But just from a standpoint at home, anytime you get a sensitivity area, or you just look at your mouth every once in a while, if you see a sore spot, if you see something that has changed, your gums have dropped or something like that, it might warrant getting further checks. But for the most part, if you're doing the normal brushing and flossing adequately every day, that keeps you pretty safe.
It sure does. Well, we got to talk about the importance of gums. And again, boy, a lot is connected to our mouths. And again, Dr. Adam Hubert, give him a call. These are the numbers. The lines will stay open. Ask the Expert is back.